Good evening and welcome to our webinar this evening on veterinary nurses courses at the College of Animal Welfare. I'm Nina DeFranco, Head of Veterinary Studies, and I'm delighted to have you with us here tonight. Jess Parks, my colleague, is going to be co-hosting with me tonight, and over the next hour we're hopefully going to be introducing you to the veterinary nursing programs that we offer, let you know what it's like to study with us and how we can support our students throughout their journey, from application to qualification and beyond. So whether you're exploring your options or ready to take the next step towards a career in veterinary nursing, hopefully this session will give you an insight that makes you allowed to make an informed choice. I am presenting from our Cambridgeshire office, and there is a massive downpour happening outside. So if there is some background noise, I'm hoping for my own sake that the rain does stop eventually. Okay, so key points that we're hoping to cover this evening, and I hope this covers things that you're hoping to gain from the session as well. And I think there's a message in the chat there as well. Just if you do have any questions throughout, if you put it in the specific Q&A box, we'll be able to keep an eye on those throughout the session, and it's something that we'll come and answer at the end. So all questions we'll try and sift through. Hopefully most of them will be answered throughout the session anyway, and we'll see what we're left with at the end. If there's any technical questions, then please just pop those into the chat and we'll try our best to help those as well. So key things that we are hoping to gain from this session, an insight that we're hoping to give you is why a career in veterinary nursing. Fingers crossed that it is something that you're keen on already, which is why you're here this evening. But we do want to make sure that it's a realistic and I suppose informed decision that you've made in order to make sure that you know what you're getting yourself in for, basically. So why a career in veterinary nursing is something that we'll touch on and give you a bit of insight into that. What options are there for entry into the veterinary nursing qualification? And we'll look a little bit, because we often get questions on this, is the difference between the apprenticeship route and what happens if you can't get the apprenticeship. How else can you become a veterinary nurse? So this goes into the diploma, also versus the degree as well. So we'll talk a bit about the Middlesex degree course and a little bit of insight into that as well. And from the College of Animal Welfare, or CAW, we want to give you a little bit of information about, why you should study with us and key points from that. So initially, I think starting on the last bullet point there as well. So, who are we? And fingers crossed again that you've got a little bit of insight, because you've seen the advert for the webinar, you've booked on, so you may have already done a little bit of kind of background reading into who we are. Well, we were founded by an animal welfare charity back in 1989. So anyone that is localish to the Cambridgeshire area, then Wood Green Animal Charity, which is just up the road from where I am at the minute, is where it all started. Way back, and to say in 1989. So the courses there have stemmed from animal welfare and charities, being the stem of what we've looked to do. We are very much an independent, not-for-profit status. So we're an independent college, and the fact that we're not-for-profit as well means that any of the sort of the income that we do generate goes back into the courses and back into the program. So we will talk about things such as, virtual reality headsets and things that we've been able to offer, and that has all come from this not-for-profit status. We're a distance learning school, so we offer courses that are purely online. And we offer sort of numerous courses within that as well. So as well as animal related courses, we have a business school too. So there's lots that we're able to offer. And it's something that even within the veterinary profession, you can build on. We find that, when we've taught students on the diploma course, they may come back and do the degree course. And following that, they might come and do a leadership and management, because they're now a head nurse in a practice. So the business school adds sort of another sort of branch to the courses that we offer. We're a work-based learning provider as well. So again, not specifically for this evening, but our animal care courses, many of those are maybe in a zoo or a kennel or a cattery. So it's purely in the workplace where I suppose the learning is happening, and sort of we will accommodate that with providing you with the tutor and the learning materials that you need to do those courses. We do also offer full-time college courses, so that's kind of my remit. So as head of veterinary studies, then I oversee all of our veterinary nursing delivery across all of our sites. So it's the kind of the diploma and the degree courses that we're running full-time within the colleges. Again, based on all the other courses that we're running, we do have, so at the centre here as well, we have the business school running, we have accountancy. So there are other full-time courses that are running at each of our main centres too. The degree programme is something that we offer in partnership with Middlesex University. So we will talk quite a bit about that. It's a big branch of the veterinary nursing course, and the main campus is obviously at Middlesex in Hendon, down in London. However, we have been granted campus status at both our Leeds and our Cambridgeshire centre as well. So if you ever drive up to those, you'll see the Middlesex campus signs outside there too. So we're able to deliver the same courses that are running at Middlesex, but at those campuses too. There are education centres throughout the UK. So again, I have a nice map coming up, a visual of everywhere that we are. So we are, as the college, the largest provider of veterinary nursing education in the whole of the UK. And I think when we get to the map, you will see everywhere that we are. We are from Guernsey to Scotland and anywhere kind of in between. So there's a good national coverage there. So the first one I wanted to start with is looking at the diploma course. So it's the vet skill technical diploma in veterinary nursing, and specifically this evening I'm going to cover more of the companion animal one. I will talk a little bit about sort of the equine that we run too, if there's anyone that's specifically interested in that. But again, it may be that it's something that you want some more information on after we've covered the session this evening. So why a career in either veterinary care or veterinary nursing? So, this is something I said at the beginning, you've got to know what you're getting yourself in for. So it is something that it's important to have an awareness of, and it may be that you've not been fortunate enough to be able to get an insight by going into a veterinary practice, or again, sort of by talking to a vet nurse or a vet. So my background is that I'm a qualified veterinary surgeon, so I qualified back in 2006, and Jess, who I'll come on to, giving an insight into her role as well, is a very qualified veterinary nurse. So between us both, we have a good understanding of being in practice, as well as seeing it from what our students are feeding back on as well. So very much is a professional career working with animals. So I think that it does have a good status with it. Any of you that are looking to do veterinary nursing, I'm sure that when you've told the careers advisor at school or you've spoken to your friends and family, they all think, great, good on you. What a really good profession to go into, because it's a caring profession, it's well respected, and it is a profession in its own right. I always think that it's an important point that if you can sign someone's passport off, then that makes you a professional as well. So we're on the list of ones that can sign off people's passports, so that counts. One thing that I think it's important to know as well, and this is just from, I suppose, doing numerous interviews. So I've been at the college now for 15 years. So I've done a lot of interviews for students for the diploma course as well as the degree course. And occasionally, not so much since I've been doing this this webinar and our open evenings, because I think I say it a lot, is when I ask people, like, why do you want to be a veterinary nurse? The people always say, oh, I much prefer dealing with animals more than humans. Now, the humans come with every animal. Every animal that comes through the door in a vet practice is attached by a lead or like a cat carrier to the person that's bringing them in. Your communication is going to be more to do with the owner than it is to do with the animal. And also, when working as a team, you're going to be in a practice with vets, with receptionists, with kennel assistants, with all sorts. The HR team, the practice manager. You can't get away with not dealing with people. So if people aren't your thing, veterinary medicine and veterinary nursing isn't your thing either. I think it's an important point to realize that actually dealing with the people is sometimes one of the trickier aspects of it, or dealing with a grumpy vet as well. I'm allowed to say that. It is very important for improving animal welfare, and I think that usually is why people are coming to this, because they care so much about animals and they want to be the voice for the animals that that don't have the voice. And so improving animal welfare is very key. And I think it's one that we don't go into too much detail about because I think you all probably have that sitting here this evening. I mentioned earlier as well about it being a highly regarded profession, and I think that, externally, then yes, I said that your friends and family will think it's great, but also, I think there's a lot of respect within the profession. So me as a vet, are hugely respectful of the veterinary nurses, and I think that my eyes have been opened even more so since starting in veterinary nursing education because I can see just the amount that they're having to learn and what they're having to go through, and I think that regardless of the degree or the diploma route, the vet nurses are learning on the job. So they're doing everything whilst maintaining a full-time role. Now, the vets, we're too precious for that. We have to learn it first and then go out into practice. So it is a tough course. And I think that the job itself has a lot. It's very hands-on, very physical at times as well. So again, you're very highly regarded within that veterinary practice too. If you start on the diploma one, and this is something that we'll cover, is that there's always progression into higher education. And there's progression beyond that as well. We can now do master's degrees in veterinary nursing specifically. And again, it's not the route that usually people would take, but we've had quite a few of our vet nurses that have gone on and become vets. So there is a progression within whether you start with the diploma or the degree, you can always sort of top it up. So I don't think that there's a ceiling on it at all. There's progression within there. The career opportunities we will cover within another slide as well, but it isn't just a one role thing. When you're in the profession, there are wide career opportunities. And I think it was one thing that when I was going into veterinary medicine, that was my kind of selling point to me. And people used to say, why do you want to be a vet as opposed to a doctor? And I used to always think that, doctors have to be so specialist. They have to want to be, I don't know, like rheumatology and just do joints and limbs all day, or they might want to be an ophthalmologist and just do eyes. Whereas with veterinary nursing and veterinary medicine, you do everything. You see every patient that comes through the door. You'll be taking their x-ray, you'll be operating on them, you'll be helping with their anesthetic, you'll be giving them their injections, you'll be working out what drugs you need to give them. So it's multifaceted. There's so much involved in it that the variety is, I think, a key thing, and not just within the role, I think within the opportunities as well within your career. Variety I've touched on there, and if there are any sort of parents within the session today as well, then jobs, jobs, jobs. The job market out there at the minute is amazing. I think all of our students that basically with the degree where they're coming without a job, pretty much 100% of them are going out with a job. On graduation day, most of them know where they're going to go off and work. And the same with obviously our apprentices are employed from the start. But when they get to the end of that program, they also have the opportunity to move around because the practices at the minute are screaming out for veterinary nurses. So the job market is very good. And there's international opportunities too. The veterinary nursing course within the UK is highly regarded, and quite often the majority of the EU countries and beyond, like South Africa and things like that, then it's easily transferable. They want us to go there, like Australia, New Zealand, and things as well, where we can use that qualification there without having to do any sort of transfer of qualification. So there is the opportunity to move around a lot. Again, one of the tutors that I was working with today, 2 or 3 years of her profession, she was spent out in South Africa in a rehabilitation centre. With I think primates and things. So there's so much that you can do with it. That yeah, you're not going to be sort of blinkered towards just working in a practice. So, what do veterinary nurses do? A lot is probably the answer to this, and this is where I said I would pass over to Jess because she can give us a real insight into. Yeah, there is no normal day, but like Jess, on you go. What veterinary nurses get up to?
So really, all our job is about caring for animals and their health. And whether that's puppies, kittens, rabbits, exotics, you might see lots of different animals. And it is such a joy to work with them all. No day is the same, as Nina was saying. It can be really busy, it can be fast paced, but it is one of the most rewarding jobs you can do. And I'm so proud to be part of the profession. I'm a registered vet nurse, I have a degree, but we provide clinical care to sick, injured animals. We monitor their recovery, we give them medications, whether that's subcut injections or intravenous injections. We help with anesthesia, so we will help with inducing them, we'll monitor them through that anesthetic. And that's probably one of the, one of the most jobs that we have where we are really in with that patient, monitoring the heart rate, monitoring the respiration rate, making sure they're safe through that anaesthetic. And that is probably one of our most skilled roles within anaesthesia. We carry out diagnostic tests, we get to take blood. I still love taking blood. I still love placing IV catheters. It's really fun. Obviously, it's really essential for patients, but it's really important you love your job. And I promise you that no day will be the same. You'll just really want to be there for your patients, get them through their procedures, make sure they're comfortable and safe. So we also support pet owners, as Nina mentioned. It's not all about the animals. Clients are very, very important as well. And we support them by offering advice, education, go through weight clinics, diabetic clinics, flea and worm treatments. We do admits, we do discharges, and we really are there for the clients as well. We do offer when patients don't make it, we'd like to save every patient, but not every patient will. We're there for owners in those moments and offer that support, whether it's a hug, whether it's listening, whether it's providing that bereavement care after. We are there all the time for clients as well as their patients. In an emergency situation, we need to be there where it counts. We need to be able to react really quickly. I do CPR. We do emergency meds, and we also can in some areas. So you can be a head nurse, you can be into practice management, you can really upskill, you can specialize and do a particular area of vet nursing that you love. I have an exotic certificate, as well as I love anesthesia, but you go into education. There's so many things you can do with this qualification. But I think like all the skills that we do bandaging, which is quite exciting. I still love bandaging, and I don't know if Nina would agree, but I do think maybe vet nurses have the edge with bandaging. Excellent.
100%. Yeah.
And about wound care, so you can really like look after wounds as well. But it's all about that TLC with your patient after, making sure they're okay. Hospitalized patients, they need a lot of care, a lot of reassurance. And as a nurse, you get to be there and monitor them and all their parameters and make sure they're okay. I'll hand back to Nina because I probably could go on for hours about this. It's such an amazing job. You're definitely in the right place, and I wish you all the best with that career. And I'll hand you back to Nina.
Thanks, Jess. So yeah, Jess has touched on quite a few of these ones as well. So it's wide and varied. It's dealing with the clients, dealing hands-on with the animals as well. But there's a lot of responsibility in that. So the monitoring of an anaesthetized animal, like again, responsibility-wise, it's down to the vet, but they're the ones doing the surgery. They need the vet nurse to be the eyes and the hands, whilst that operation's going on as well. But vet nurses can also take on, I suppose, their own specific roles within a practice. As Jess said, then, she has an exotic certificate. So it may be that would be her focus within a practice, that when you have rabbits coming in for health checks and things, that actually they wouldn't even see the vet, they would go and see Jess first because that's her area of specialism. There's a degree of admin associated with it, but some people love being in the lab as well, looking down the microscope, taking the blood samples, checking it, and just seeing those operations day to day. So the majority of practices, which we'll come on and talk about in a bit, there's operations every day, there's x-rays every day, there's consults every day. There's so much variety that it definitely keeps you on your toes. So I saw this slide once. It was probably on social media, but it really it kind of triggered in me, I think, thoughts that that sums it up perfectly. And it's where it says that a veterinary nurse is also an anaesthetist, a surgical assistant, a fracture nurse, a phlebotomist, a lab technician, a radiographer, an infection control officer, paramedic, administrator, counsellor, nutritionist, teacher, first aider, cuddle buddy, and much, much more. No matter what they say, they do take their work home with them and are always thinking of the patient's care. Thank goodness for veterinary nurses. So I think this was probably on Vet Nursing Awareness Month, but again, there's still more to the role than that, but it's everything and more. And again, it is something where you do worry, and the concern for your patients doesn't just stop when you walk out the clinic that day. Quite often, you'll be on the work WhatsApp at night, going, "Oh, how is that dog doing? Like, is it has it eaten anything yet?" And that's the profession. It's a caring profession, and I'm not saying that you have to be working 24/7, but often your mind will still be there with some of those patients that you've been caring for during the day. So career options, we've touched on a little bit, but again, it's important to be aware that there'll be an idea in your head as to like a veterinary nurse, and you'll think of one of these ones, depending on, I suppose, the experience that you've had, bringing your own animals in, or maybe programs that you've seen on TV. So it will be different for each of you sitting there this evening. But the general sort of first opinion practice, like your GPs, that we would go to ordinarily to see the doctor or the nurse, those are the ones that you're seeing on the high streets, and that's a first opinion practice. So it can be a small animal one, it can be small equine, or it can be mixed, where if you're more rural, it might be that they see small animals and your sheep and your goats and your cows. But it's where everything that I've just spoken about in terms of what the vets and the vet nurses do happens there on a daily basis. So they see everything. They see the animal that's just been run over. They see the puppy that's in for its first vaccination, the tortoise that's coming in for basically to be dewormed. So they see everything that comes through the door initially. When they see more complex cases, that's when they have the ability to refer that on. So the second one on here is referral and hospital work. So, if you've watched some of the super vets and things like that, then you'll be aware of just the level that you can see that is happening in hospitals and referral places where it might be a really complicated case of, I don't know, an animal that's had a complicated fracture, or it's a really complicated neurological workup, and the GP practice just doesn't have the specialism or the equipment, so they need to refer on. It might need an MRI or a CT scan that, although some first opinion practices are getting those in, most of it needs to be a referral job for those. So it can be a very sort of specific set of skills that you're going to need to work in those. And some of our nurses start there. That's their first role is in referral work, and actually they'll become very specialist in that area and might want to move out of it, or might have to be kind of seconded to general practice to see a bit of the everyday as well. Quite often that's where you have key areas of focus. So the vets within a referral hospital will have their area of focus. So you'll get your orthopedic surgeons, and all they're doing is fixing all the bones. You'll have your ophthalmologist, and all they're doing is seeing and fixing all the eyes. And each of those will likely have a nurse associated with them as well. So you'll have your specialist areas and be able to see really complex cases within this. Charity work you're probably all aware of. So ones like the PDSA, the RSPCA, the Blue Cross. Charities, it's a big industry as well. And quite often, again, we've got lots of students that start in charity. And some people, when I'm interviewing or at the end of their course, they're like, that's what I want to get into. I don't want the barrier of whether someone can afford treatment to be kind of, how it's determined what care they get. So charity work is quite popular for a lot of our students and qualified vet nurses as well. Academia research also ties in with education, which is the last one on there as well, is that, all of us that are here this evening, including our co-events person, are within the veterinary profession and have all moved into sort of other lines using that qualification. And I'm very fortunate in the team that I manage. Is a team of vets and vet nurses only. So at the college, you're only going to be taught by someone that is a qualified vet nurse or is a qualified vet. And they've all chosen to go into this career to use their skills in a different way. And that can be done through research as well. There's lots of openings for, like some of the nutrition companies or some of the pharmaceutical companies within industry where they're looking for vet nurses to be involved in either sort of sales to do with it or research as well. So you can move around a lot as well, and you can have like your 5-year plan. We speak about this a lot whenever a student finishes at our on our courses, we always have a meeting with them. It's called a next steps interview. And we always meet with them and go through everything that they've enjoyed about the course, what things they would want to improve. But also in there, we want to get an insight from them, like, what do you want to go on and do? And some of them are like, I just want to be a vet nurse for a while. I just want to stay where I am, and that's it. Some of them have already got it eyed up, and they're like, you know what, I'm gonna be a head nurse in 2 years' time. I'm gonna do a top-up degree after that, and then I'm gonna come back and teach. And it's quite interesting because quite a few I can name about 4 or 5 of the lecturers that we have across all our centres at the minute have been previous students. So their plans work. So veterinary nurse, again, it's just a reality check, and I think this one there's definitely a little bit of sort of change happening within this as well. Is that quite recently there was one of the big corporate practices that decided to introduce that all of their veterinary nurses would start on 30, regardless. And I think we've then had a little bit of a creep up where some have said, okay, all of ours are going to be on 35. So when I first started in this role, students were, well, not even students, qualified vet nurses were in the low 20s, and it is moving on much higher and higher. And I think depending on geographically where you are, but also some of the areas that you're working in, we had a referral practice that's up north. It was to do with our Leeds centre, and they'd come in to do a talk on a careers day, and like my students' eyes popped out their head when they put up the slide saying that all of their nurses start on 40, and if they get sort of qualifications beyond that, it could then go up higher. So there is the opportunity for quite a reasonable wage associated with the role as well, again, depending on the area that you're in. And I mentioned before, the job market, there's a high demand from employers. They are all looking for veterinary nurses. And we're very fortunate that, again, as the largest provider, we have a good insight into where the jobs are and how to prepare our students for getting those jobs as well if they come to us when they don't have a job or they don't have the apprenticeship. So this slide is a recent introduction. So I do quite a lot of open evenings. I try to do them at all the centres that we're at, and we do them a few times a year as well. So we do have face-to-face ones across all of our sites. We've got ones coming up in October as well. If any of you did want to go to an in-centre one, it would be a very similar presentation, but you would get to see the centre at the same time. And based on some of the questions that we kept seeing from those, I put this slide in, which is what I hope an overview of veterinary nursing training and the options that you have available, and then the streams within that as well. And I'm trying not to keep an eye on the chat because it'll put me off, but there's a few questions in there that I hope this answers quite a few of those questions as well. And I think it's a sit back and try and digest it all, because if you understand this slide, the rest of this evening will make a lot more sense. And that regardless of the route you take, you will become a registered veterinary nurse. You will register with the Royal College of Veterinary Surgeons, whether you do the diploma course or whether you do the degree course. So that's a given. And actually, one thing to say with like the jobs and the salary is that there is no differentiation in salary or jobs between the two routes either. If you look at the jobs now, if you were to sit in Google, there's no advert for sort of the in-practice ones that specifies you have to have a degree or that they want a diploma nurse. They just want a registered veterinary nurse. And so the only way it starts to creep in is if you're looking specifically for maybe a job in academia, for example. So, if we've got our lecturers that are teaching on the degree, then we obviously want them to have a degree for that route as well. So it doesn't really restrict you. So both of these courses, you need to pick the one that's right for you. And so we have the level 3 diploma and we have the degree course, the BSc Honours in Veterinary Nursing. So with the level 3 diploma in veterinary nursing, you can do this through two routes. So if you're fortunate enough to be employed by a veterinary practice, then that is great. And a practice has employed you and they're going to be sending you on the course, and the chances are that that will be through the apprenticeship. So you don't have to pay anything and you will get paid to do your training. That is a 2-year course, and it can be done either at a centre or it can be done virtually, similar to what we're doing this evening, but times 6 hours. Um, there is a slide I have coming up about how to get the apprenticeship. So we aren't able to find students apprenticeships. We take students that have an apprenticeship or have been employed by a practice, and their employers send them to us to do the training. We can give you tips on how to find those. And what we were finding, certainly through a lot of these open evenings, is that people would be sitting there and saying, I've been trying for 2 or 3 years to find one. And it is, when we speak to employers, they'll say, actually, we had like 200 applications for the last apprenticeship vacancy that we had. So if you're not hearing back and you're not getting anywhere with it, it's not really a you thing. It's because there's so much demand for it. And because of that demand, we've introduced a non-employed route. So for students that just want to do it, they just want the qualification and they know they'll get a job at the end of it, then the non-employed route is where basically you come onto the course and you will sit and do the same course as the employed students. You might be in the same group as them, you might be in the same centre as them. The course doesn't change. We don't change anything because you're not employed. You still do the same course the way that they would do it. It's a 3-year course, and the reason for that 3-year is there'll be a year within that where we will find you a placement. So we'll find you somewhere, hopefully local to you, where actually the practice sign up and say, yeah, that's fine. We will allow them to do everything that they need to do to get their training, to take the x-rays, to inject the dog, to answer the phone, to do a weight check. And so you'll not be paid within that because, again, there's legal issues around that. But you will get the experience that you need. And the 3-year program is that you do, as I say, the same theory as the employed students. It's just this placement year that we'll find you that placement for that. And the intake is the same. So we still run it 4 times a year. So I will say it's like buses. If you've missed one, there's another one coming soon. So we have just had our July intake. In October, we're about to do another intake. In January, we're doing another intake, and in April is an intake after that. So it's rolling. We're constantly, it seems, interviewing for students, and in the other way, we're constantly seeing students qualify as well. And when I come to show you where geographically we are, then it can be that if you're, right up the road from our Cambridge centre, you'll come in here, or North London or Leeds. But if you're kind of more geographically restricted in where you can get to, then you still can do the course. You do it online, and only when it comes to doing the practicals, which is right at the end of the program where you have to come and do it at a centre, we have satellites spread across the UK. So you would just find the nearest one, and that's where you would go to just for that block and that block only. The degree course, and I will speak even more detail about these courses, but this is just a visual. So with the degree course, again, there's 2 options to do this. So it's a 4-year BSc honours degree. So if you start it in first year, you meet the grades, then that's great. That's kind of the usual degree courses that are starting or just about to start in September, October time. But what we found as well is that there were students that really wanted to do the degree, narrowly missed out on their grades. And so we found sort of a foundation year as well for this one. So it works out as a 5-year program. However, that foundation year gives you what you need. So if you didn't quite meet the grades that you needed for straight entry onto the degree, or even, we've had some students that are just like, I think I've not been in education for a long time. I want to start with the foundation course. It's a good grounding for maths, English, and your sciences, and basically just into the profession as well. So you do your foundation year, and then after the foundation year, you then basically follow the degree program, the same as the other. So you'll join the new first years and you'll work through the program with them. It's all face to face. So as I said earlier, it happens at Hendon, which is our biggest intake. It happens here at our Cambridgeshire centre, and where Jess is this evening as well. It happens up in Leeds as well. So there's 3 options, and they all have a little bit more of a, well, they all have different experiences because they're different centres. Our Cambridgeshire centre, for example, it's quite small. You're not going to have, there's not a Starbucks on hand, but there is a coffee shop. We don't have a big campus. We have our lecture rooms, we have our clinical skills suite, we have a coffee shop. And for most of the students, that's all they want. But if you do want the big university experience, then it's something that Jess will talk about when we talk through the options for the degree. Then that is Hendon, that's going to Middlesex, and that's having that university experience there. So training as a veterinary nurse, again, I hope I've captured all of this, is that either you do it through FE, further education, which is a diploma and apprenticeship, or you can do it through higher education, which is your degree. There are some key things that are similar for all of them, which is you have to at least be 16 years of age, but obviously for most of the criteria, that's a given. GCSEs then, because the courses, regardless of diploma or degree, they have to be kind of awarded by the Royal College of Veterinary Surgeons. They've stipulated some key things that we can't budge on, and one of those is the GCSEs. So the GCSEs is a given for both the degree and the diploma, which is 5 GCSEs at grades 9 to 4, or old currency, A star to C. It has to include English language, maths, and a science subject. Obviously equivalencies. So, if we start looking after that at the likes of any sort of I'm just trying to think BTEC or things like that, then we can look at those as well. Work experience, we can talk about a little bit later, but we're finding, as I'm sure many of you are, that it's very, very difficult to even get work experience. The door seems to be shut on that, and it has been even more so since COVID. And so we've actually, for the courses, taken away the requirement to have work experience, because we're finding that students just can't get it. We will help find work experience. So if we've sort of taken you onto the course and there's a gap between you being given a place and starting, then what we can try and do is maybe the placement that you're going to go to is that we get you in there for a week or 2 weeks. So you've actually met the team and got that as sort of work experience beforehand as well. So it is something that we're looking into. But yes, it's great if you can have it. Amazing if you get that opportunity. So don't give up trying, but it is no longer a requirement that we've put within the course there. So the requirements for the diploma. So the diploma you can do straight from GCSEs, or again, we'll talk about the veterinary care assistant course as well. So actually, if you're sitting here going, oh, I don't even have that, there are other options as well for you to do it. So I will talk right at the end about our veterinary care assistant course, which basically gives you the equivalent of the sciences, the maths and the English, to allow you to go on and to do the veterinary nursing course. So it's the 5 GCSEs, grade 4 to 9, and including English language, maths, and a science. So how will you learn? It's a busy course. I've said that a few times already, and it really is. There's a lot involved in it. You will be doing multiple choice exams, and you'll be doing those sort of 4 times a year. So the way that the diploma course runs is it is done in sort of 12-week blocks throughout the year, and each block at the end of it is your exam. And so it's like do all the theory, do the exam, move on to the next one. And so those are all multiple choice exams. There are some assignments within the course as well. So academic writing, referencing is a strong area. So, again, hence why it's important that you do have that kind of literary skill as well. There's practicals involved. Usually the assessment for that doesn't come until right at the end. But it's basically looking at you evidencing that you're able to do all these skills that you've been signed off in practice. So as Jess said about bandaging, you might go into a station and they might present you with a dog, and you have to kind of identify its wound, bandage it all up, and do it very neatly within 6 minutes. Also, the portfolio of evidence is this is what you're doing in placement. So if you're an apprentice and you're employed, you'll be doing it when you're not at college. So normally you're coming into college 1 day a week, and the rest of the time, if you're employed, is those 4 days are just in practice. For the non-employed students, this is what you do on that year within placement, and it's just gathering all the evidence that you need basically your mentor in practice will be demonstrating skills to you. You'll be practicing and practicing and practicing, and eventually you'll be signed off as competent. And that's what you need to finish within that time that you're there. The suitably qualified person is an extra qualification that comes along with the veterinary nursing one. So basically you come out as like a mini pharmacist as well. So it's a new qualification that actually, if you've got people that are in practice and have been qualified for maybe like 5 years plus, they probably don't have this. So it's a relatively new addition. And it is something that it's a qualification on it in its own right. So we have had people that actually they can go off and that's what they want to do, is just to do this SQP role, working in a pharmacy or working in sort of a large pet shop. But it does come alongside the veterinary nursing course and kind of enhances, I suppose, your role there as well. Course delivery, I have mentioned. So the face-to-face is, we're offering it. There's 2 intakes a year that are specifically for the face-to-face course, which is October and April. And those ones are where you would be coming into a centre every week. So once a week, you'll be coming in and you'll have the lecturer there in front of you. You'll be sitting with your peers, and you'll be learning the material. At the same time, we have students that have opted for virtual, so the live online session, and you still have a live lecturer. So you can see the screenshot here is that there's a lecturer that's there with you. They're monitoring your interaction. They're speaking to you similar to tonight, maybe on the chat, maybe you're joining in, and you've got your webcam on and you're talking to your peers. But the same presentation that is happening in the centres is happening online. So you're getting the same student experience. And again, that's part of my role, is making sure that these are all staffed appropriately, but also that the standard is the same, whether you're at Leeds, whether you're watching someone online, or whether you're sort of down in North London. So it's finding what works for you. It may be that geography kind of already predetermines where you're going to go, and you have to do the live online. But actually, sometimes we have students that are relatively close, and they might start with the live online, but then they might think, you know what, I feel quite isolated by this. I'm just going to drive for the hour, come into centre, and sit there with my peers as well. So there's a couple of options that you have. So what will you learn? Lots. I'm not going to read through all of these ones. And this is where I said, actually, there's the parallel with the equine here as well. So if you did opt to do sort of an equine course, then it's very similar that you would do just with horses. So it's a very busy course, and each unit is associated usually with an exam, and some of them with an assignment as well. Some of them are purely practical. So VNO5 or EVNO5 is just assessed on, can you do these practical skills? All the other ones are key things that you're going to work through and basically meet what the RCVS, or the Royal College of Veterinary Surgeons, stipulate as day 1 skills. So these are the things that we want all of our veterinary nurses to be able to do. So again, there will be parallels with what's covered on the degree course as well. So I promised you a map, and here you have it. So this is geographically where we are. So our big centres, where you would go face to face, is Huntingdon, so that's our Cambridgeshire one. North London, which we run out of the Stonex Stadium, and Leeds. All of our other ones are ones where you wouldn't go in every week for a theory lesson. You would be doing it online with all the other virtual students. But when it comes to doing practicals, or potentially if you were sitting an exam and wanted to go into a centre, some of them have exam status as well, is that you'd be able to go to those ones. So there is quite a good geographical spread, we think. And I'm sure my director would still be looking for more if he could. But we have managed to have students from, again, quite a few different places. And yes, there might be some gaps, but if you were virtual, the maximum number of weeks really you're going to be going in is probably looking at like 10 to 12. So once a week, right at the end of your program. So it's not going to be for a long time, and it's going to be for quite a short block that you would actually be having to go into one of these centres if you weren't that local. Because I know Scotland in particular, if you're way up in Orkney or something like that, it's quite a trek to get to Edinburgh each week. But if it's only once a week for a short period, and you know that it's coming in 2 or 3 years' time, then hopefully it's time to plan for it. So the course structure, again, I think I've spoken quite a bit about that as well, is that if you are employed, your employment is down to your employers. They'll tell you what rotas you're working and they'll have to give you that college day off. So you only come in for one day. Um, if you are non-employed, then you're coming in for that one day a week, but you'll have 2 days of other work that you have to do. We don't specify the day. So this works for some people, quite a lot of our students actually, where they're maybe still got a full-time job. They might be still working, I don't know, they might be working in retail or they might be working in a category, for example, and they can keep that job up 4 days a week, come into college on one, and then the other learning that they need to do, they factor into evenings and weekends. It's only until that placement year where they have to sort of make the time and be able to commit to the 5 days a week in placement for that one. Fees, everything is on our website. So, I mean, this is as of, going to press. I've taken it off yesterday, but there are obviously different options depending on if you are employed, not employed, and again, if you're overseas or not. So there are lots of different ways or a few different options, and this is specifically for the diploma. For the degree, then obviously the student loans company is where you're looking at for that. But with the diploma, then the fees, it may be that you self-fund and you're able to do it that way. But there are options such as an advanced learner loan. And even with the advanced learner loan, there are other options that if you're getting that, sometimes you can even tap into bursaries that look at sort of helping with childcare and things as well. And we also offer sort of a loans to learn scheme as well that you can look into. But we have a funding team here that actually, if you were to call them up and explain your circumstances and what you wanted, they'd be able to look into the best options for you and whether it's a block payment or what you can do as well as pay as you learn, which is monthly payments that keep going until you're qualified. So finding an apprenticeship, then, there's lots of advice that we can give you on this one. And it is really difficult. So if you're holding off and trying to find that before you start, it may be a while. You might be lucky and you might find one really quickly, but there's a lot of interest in the jobs. I just did a quick snap of one that we have on our website currently. So where to look is obviously college and welfare, any of the apprenticeships that are training practices offer, quite often they'll come to us and ask to put it on their jobs boards, but otherwise it's the same as most jobs. You're looking at the government website for apprenticeships, you're looking at Indeed, you're looking at VetClick is another one. So if you just search student vet nurse apprenticeship, student vet nurse job, those are the key ones that you're going to be able to go through. And it's also building connections. So don't think that it has to be the student vet nurse one. Actually, if you've got time on your hands and you see a receptionist job or a kennel assistant job, maybe go for those and you get your foot in the door. And what we find is that a lot of our students, when they're coming through the employed route and coming through the apprenticeship, they've been in those practices for numerous years. They started as a receptionist, they started as a Saturday girl. So don't be blinkered to just looking for student vet nurses. Think a bit wider than that as well. I'm now going to pass over to Jess for her to give us a little bit of a insight into the degree.
So, yeah, I'm going to talk you through the degree program now, which is very exciting. So we're still open for people to apply in clearing, which I'll explain as I go through. But we have the BSc Honours Veterinary Nursing degree, we've got the foundation route, and we've got the first year degree route, and we also have the top up as well. So next slide. That's okay. Thank you. So our course entry for the higher education programme, so you need 3 A levels at CCC or 2 A levels at A star B or AA to include a grade C or above in science. Or you could have an alternative route, so the 3 BTEC level 3 extended diploma, such as distinction, merit, merit, or 2 subjects at distinction, distinction for our HEVN programmes. Next slide. Okay, so for our program, so it's a 4 or 5 year program if you do the foundation year, and it has 52 weeks of placement included. And we have 3 campuses, so we have one at Leeds, one at Huntingdon, and one at Hendon at the main Middlesex University Centre. So you can make your application via UCAS and going through clearing. And if you're wanting to go to next year, you would do that before the January deadline. So we interview all applicants, so your interview would be arranged. We're super friendly. We're just here to see why you want to be a vet nurse, and talk through your qualifications, see that you've got the right requirements for the course. You can ask us any questions you want to about the programme, and then hopefully that you will want to come and study with us. So you need 2 weeks work experience in a veterinary practice would be a really good advantage, but any animal related or customer service focused experience will also be considered to prior to admission of the program. So yeah, it's a really good program, and I'm going to talk to you about that in a second. So if we next slide, please. Okay, so this is how our first year program works. So in year 1, you would study professional development, and then go on to do fundamentals in working in a veterinary environment. You then do your body system. So you're going to be learning about your anatomy and physiology, so the gastrointestinal tract, so the digestive system and integument systems. And then you will do your practical and then go out into placement for placement 1. We have a dedicated placement team that will help you find a placement, but you'd need to write a CV, covering letter, and go to the interview with that placement to secure it. But we help you, we support you, and then you get to go and do all the vet nursing skills out in placement, which is great. And then you'll be completing what we call your nursing progress log, or the NPL, which is a list of skills that you need to complete to say you're competent. Your clinical coach, which will be the person that looks after you in practice, will open up the skills and then decide when you're competent, and you will log your experiences as you do the skills. So as we were saying earlier, skills in anaesthesia, maybe skills in bandaging, client communication like admit and discharges, all of them will be a skill that you need to get signed off. These are called the day 1 skills. And then once you've completed year 1, yay, you're going to move into year 2. So you're going to do professional development 2, and then go into your body system. So you'll be learning about your endocrine systems, learning about the musculoskeletal system, which is really exciting. I mean, like, I love anatomy physiology. Hopefully all of you out there love your sciences as well. It's really important that you know your body systems, because we need to be able to know how medication might affect them, how anesthesia might affect them, and lots of other things, and it gives you a really good background. You'll then go on to your urogenital systems and then go into theatre practice. So theatre practice, where you'll be learning about instruments, learning about how to help the vet during surgery. So opening everything aseptically, how to scrub up, all of those sorts of important things as well. And then you do your second placement, so continuing with your nursing progress log. And then you move into year 3 and continue on your placement. You do professional development, finish off the body systems with neurology, and then you learn all about anesthesia and how to monitor anesthetics, which is really exciting. And then you do your cardiovascular and respiratory system. And then you move into your final year, so we're very close to graduation right now. And you do practical and placement 4. So you finish off your NPL, you do your professional development, and then we do emergency and critical care and your contemporary vet nursing, and you do your suitably qualified person qualification as well. So learning about pharmacy, medications, drugs. And then you go to graduation. So we all go to graduation. We can't wait as your tutors, and we all celebrate with you. We watch you throw your hats in the air, and you will go to the ceremony. Everyone is welcome to go to the Hendon site, where we have your graduation ceremony. And then you also will declare that you'll make animal welfare your first priority at the ceremony in the second part, which is where you end up on the register. So you become registered vet nurse, which is very exciting. And we all really celebrate with you. It's a fantastic day. It was a fantastic day this year, wasn't it, Nina? It was just amazing. So that is the overview of the 4-year programme. But if anyone has any other questions, you can reach out to us after this event, and we can answer any other questions, or you could come to one of the open events, as Nina was saying. Can I have the next slide? Thank you. Okay, so the top up, so this is where you are already, if you're already qualified, you would come back and do the top up program to get the BSc honours degree. So if you've done the diploma, you could come back and do the top up degree. So it's a 2-year or part-time 4-year program, and you need to have the level 3 qualification or the foundation degree in veterinary nursing to do this program. So it is a mixture of distance learning, and you'll attend online. And there is a mixture of live online seminars and tutorials, and you'll do lots of different modules and you'll develop on what you've already done. So again, really good program. So if there's anyone in here who've got any other questions on the top up, just drop them into the Q&A. Next slide. Okay, so our BSc program. So why should you study with us? I think that's really important. At the moment, we are #1 in the UK for veterinary nursing program, according to the National Student Survey. The National Student Survey is a survey that all students are asked to complete after they've completed their degree program. It's nationwide, and we are #1 for the vet nursing program, which is great. And that's been 2 years running. So really, really pleased about that. So we got fantastic scores across the board in all areas for that. And it's an amazing achievement, and it shows our continuing commitment to academic excellence and student support, and the preparation that we put in place to make sure that you have the best student experience while we're with us. And we have loads of different areas that we will help you. We've got really good student support. We've got technology such as virtual reality that we will show you how to use, and that you get the chance to do that, which will help you practice. So we're absolutely thrilled to retain that position for a 2nd year. So it is really worthwhile, our program. We hope that you would love to come and study with us. Of course, I'm biased, but it is such a really good program. So I'm just, yeah, that's great. So when we are doing here, so here you can see here, so these were all of our scores. We met the benchmark and we're in the 90s for all of the areas. So all of our students say teaching on the course is really good. So that's 98%. We got 100% in areas such as student engagement, and we make lessons really interesting and engaging. Learning opportunities was 94.5%, and I'll let you read all of the others. But our programs is really good. Just don't take it from me, take it from our students. And if anyone's got any questions on that, let me know. Can I have the next slide? Would that be okay? Thank you. So essentially, clearing is still open. So if anyone in here wants to do the degree program and wants to be in this year's intake, please do apply by going through UCAS clearing. So we've got the link there. If you could put that link into the chat for me, that would be great. And you can also phone this number as well. So hopefully some people here are thinking, oh, I'd really like to do the degree. And you don't have to wait till next year. You could come right now, which would be great. So next slide, I think, and then I think I'm handing back to you at that point.
Yeah.
Great.
I'm not sure what happened with the slides there. They just disappeared, but thank you for carrying on regardless.
No, that's fine.
One of the key points that I wanted to cover as well is very briefly, and I know this is specifically for veterinary nursing. However, what we found again over the years, our experience is that actually talking about the veterinary care assistant course is quite important, because there might be quite a few of you sitting there not having the GCSEs but really wanting to get into it, or being at that point of study where you might be finished your GCSEs, but not quite ready to go on to the veterinary nursing course yet. So veterinary care assistant is a role in itself. So I think it's important just to mention them, that actually the career options, when you read through them, you think, oh, that's just the same. So everywhere in a practice that you'll find a vet and a veterinary nurse, you'll find a veterinary care assistant too. Quite often you'll find more, because they're very busy. They're very much more hands-on. They're not really dealing with the clients as much, but they're very much dealing with the day-to-day of the care for those animals as well. How to become a veterinary care assistant? The good thing with this one is that it's roll on, roll off. So you could decide tonight, actually, that's a really good idea, and you can call us up tomorrow. And I'm not saying you're going to start on the program tomorrow, but actually we can get the ball rolling for you to be on that quite quickly. There's no entry requirements. So you don't need to have GCSEs, anything in order to get onto it, because this gives you the grounding and the level that you would need to then work beyond that. So it's a level 2 program, and you can add into the program completing your maths and English alongside it. So actually, if you didn't have any GCSEs or you didn't have the right results, the veterinary care aspect of it gives you your sciences, and tapping on the maths and English gives you obviously the maths and English as well. So you can come out of the veterinary care assistant course fully ready to then enter into the veterinary nursing. You do have to either be employed or volunteer within a veterinary practice. Usually it's much easier to get into than like training as a veterinary nurse, because you don't specifically have to go into what's called a veterinary training practice. You can go into any practice, and the time scale that you're looking for is not as much. You're not asking someone to take you on 5 days a week for a year. You're just asking for sort of a maybe like 10 to 15 hours a week, or 30 hours a week potentially, if you want to get it done full time. It can be done within 6 months, the course, if you're quite quick and on it. You have to have a mentor in practice, and it can be done from the age of 16. So the other key point there as well is looking at support at call. So it was just something that I wanted to touch on here as well, is that one of the slides at the beginning was talking about well, why call? Why would you come to us? So we kind of did the sales pitch at the beginning, but after that, then looking at the support that's available is that we have placement officers. So if we are sending you out onto a placement, or if you are in a placement even in the sort of Shetland Isles or something like that, you will have someone that will come out and visit you. We will come out and we'll see you there within your practice, and we'll just see how things are getting on. Veterinary nursing lecturer. So I said earlier that all of our teaching team are qualified vets or veterinary nurses. They're hugely experienced. Like Jess, they might have additional qualifications as well. And the support that they're going to give you while you're on the program, they'll be doing revision sessions with you and one-to-ones and help you with your assignment. So there's lots of involvement from them within the course as well. There's a clinical supervisor, which is basically your mentor in practice. So when you're in practice and or on placement, then there's going to be a mentor that is assigned to help you through everything that you need to get through. You've got people that are marking your assignments. You have tutors that are teaching you specific clinical skills. And we have a big learning support team as well. So if you're coming to the college with additional learning needs, then that's something that we offer support with. Or actually, if you're coming to the college and you've not been in education for a while and suspect you might have additional learning needs, we can help support you get the support that you need. So, if that's a testing or diagnosis, we can help with that as well. Academic advisors is basically like your go-to. It's like your buddy throughout the whole of the program. It's someone that you will be bouncing off of if you've maybe just failed an exam, or actually you're going through a tough time at home. So there's lots within there that we try to support our students with. One thing I did want to mention as well, so obviously with the degree at Hendon, the student accommodation associated with Middlesex, we don't have student accommodation available at Leeds. However, it is kind of a university city, so people are often able to find their own private accommodation. At Huntingdon, we do have sort of a small number of student houses. They look quite nice, so I thought I'd put the slide up as well. They're not all like this one. There's a few different ones, but they're shared houses where 4 or 5 students will have a room each, and then you have your shared kitchen and communal area as well. Quite luckily for them is that literally, and I don't know why they're ever late, it's a stone's throw away. So it's literally across the road, next to a park and a co-op and a chip shop. And that is something that works quite well, because actually when Jess was going through the placements, you're not in college for a huge fixed period of time. It's usually sort of like a 12-week block, and you would only pay for the accommodation for that time. You don't have to sign up for a year's lease. So the Huntingdon one, if it was that you were maybe based in London but needing to do the foundation year, you can have the accommodation for that first year as well. Oh, slides are going all a little bit wonky. I've mentioned VR as well, and I think that's an important point to mention, is that actually within the program, our degree student, well, all of our students get access to a virtual reality headset, and it's something that we can actually give them to provide them with a very safe environment to learn things, not necessarily dealing with a microscope, but it's a bit more sort of life or death, where you might have an animal in front of you and you're having to take a blood sample from it. You can practice virtually before being let loose with an animal. So again, you can watch some of our YouTube videos on that on the internet, I suppose, and have a little look at what we're offering there. So do you want to find out more? Hopefully, we have told you a lot about some of the questions that you've been asking in the chat, and also that you may have come with this evening. If not, then there's the opportunity now for you to stay on and we'll answer some of those questions. All of the information I put up here on our website, or emailing us or following us on socials is obviously quite important. But for now, it's just to say a massive thank you for your time this evening. We've really enjoyed, I think, going through the courses with you, and I suppose the job and working within a veterinary practice as well. And yeah, you are more than welcome. If you don't want to stay on and go through the questions, then thank you and good night. But for those of you that want to stay on, then I think there are some questions that have maybe come through while we've been doing the talk this evening.
Great. I'll make a start with the questions then. Perfect. Okay, so the first one, do the study days stay the same in the courses in prior years? For example, the July 2025 intake, the day was Wednesday. Will this be the same for July 2026?
Not necessarily. They do change. We do try and put them on our website. Normally, this quite far in advance, so you know what day it will be. But it is something that has to change depending on room availability at all of our centres, so it won't always be the case. Usually, it might be 2 years down the line, actually, that it stays the same because we're swapping one group that started with one group that's finished. But yeah, no, unfortunately, there's no guarantee of date other than the ones that are advertised.
Perfect. Thank you, Nina. So the next question. So regarding start dates, if I start in October, I am away for January. Could this be worked around?
If you say that again, sorry. So they want to start in October. Is that the question?
Yes. So they were asking that if they,
Usually, yeah,
oh,
usually
sorry.
with any attendance, I'm just trying to think if they're off for the whole of January, then it may be that they would look to start a bit later. If they want to start in October but would be off for the January block, then they might need to suspend their learning and then start again in April. So we do have every course running 4 times a year. So it would be something to mention at like at the point of admissions, or if it's like beyond that, is getting in contact with us now just so we can look at that, because there would need to be a suspension on the student status for, I suppose, that 12-week block. So it wouldn't just be January, you would have to suspend for the whole 12 weeks.
Thank you. So the next question is, I'm looking to do the distance learning non-employed. Can some of their volunteer weeks be completed in year one?
Um, the volunteer weeks, I'm not sure. So the placement weeks where you're doing it has to be at the end of year one, just because we need to give you the grounding that you would need to go into placement. So usually it's at the end of year one. So you do your first year, go out onto placement, and then come back for the remaining sort of theory ones after that.
Brill. Thank you. So the next question would be, so they'd like to know about the entry for international students and if there are exceptions in terms of different qualifications. I think for international students, I think it would be best to reach out individually so we can discuss your individual requirements and have a really good discussion. Would that be okay, Nina? I think that probably
Yeah,
would be
yeah,
probably the
because
best
it's
plan. So if you could please, the core events, please put the contact details for those students asking about international qualifications. If you could just give them the contact details, that would be fab. Thank you. And then how many students do the distance learning non-employed route? What percentage complete the course and subsequently register with the RCVS?
The non-employed route is a relatively new one. I'm just trying to think. So we have done it previously in the past, and then we stopped it for a while just because we had so many apprentices coming through, and it was only July last year that we really picked it up again in terms of big cohorts coming through. Um, in the past, then we've not really seen any difference between I suppose, the qualification and the registering with the non-employed and the employed students, because again, they're getting the same teaching experience. They do have access to sort of really good support in placement, and quite often, they've got the real dedication there as well and the focus, because a lot of them are paying for it themselves as well. That they're like, I'm going to get it done and I'm going to get it done on time. So our well, what we're seeing in terms of results is that, it's quite a high percentage that are passing. When it comes to the last exam, the OSCEs, which is the practicals, we're looking at sort of high 80s, 90% pass rate for those, and those are the ones that are then going on and sort of entering the register straight after doing that as well. So the balance shifts. So it used to be, as I said, a massive shift towards the apprentices, and 90% of the students we had in our class were apprentices. Now I would say it's maybe going to like 60%, and then 40% of them are non-employed. There definitely is a shift in that direction.
Perfect, thank you. So the next question. So when we discussed, Nina, in the presentation, we discussed about international opportunities. So would opportunities exist in North America, thinking about Canada as well as following completion, or because they are on the side of vet techs in North America, is that a non-option for UK qualified nurses? So I think once you've qualified, you can go anywhere, but you'd need to see about if your registered vet nursing qualification in the UK would
Yeah.
still be transferable if you go abroad. But if you're asking about international placements, I will put the caution on that because I think most of them will need to be done within the UK. I think you can do an international placement, but I don't think it counts towards your hours. So we'd need to have a look at that on an individual basis. So you could reach out to the degree program manager to discuss, and hope that answers that question. But if not, we can pick it up outside of here, I think. But it's really exciting that people want to go and do international placements. I love it.
Yeah.
If that's the case. So this student says if she's unable to apply for student finance because it would be their second undergraduate degree, but they can't afford to fund the diploma, are there any options for funding for the diploma, for example, advanced
Yeah.
learning loan?
Yeah, so it will be different. So if you started on the degree, the funding of it is completely different. So the advanced learner loan basically is tapping into a different pocket of money. So that would be an option. And again, the advanced learner loan is very similar in that you wouldn't be paying it back until you're beyond a certain threshold, and after obviously you've qualified as well. So that is something to look into.
Thank you. And then we have another similar question, and they are saying that would they need student finance? So I think if you're asking for the degrees, this was Carol about doing the degree, you would need student finance to fund that, or you'd need to be able to fund it yourself. So I think again your query might be something we need to pick up outside of here, and it sounds very individual to you. So if you drop us an email, we can get in touch and have a discussion, because I think there's some other questions about some students have already done part of a program before and then had to go because of different reasons, and
Which
they
is
want to
fine.
pick it up
Yeah,
again, which is
we have
great.
lots of that.
Yeah, exactly. But I think we just maybe need to chat to you on an individual basis.
Definitely.
Bro. So that's that one. I've got a few questions asking about being a mature learner, or picking this up after having done another jobs for quite a few years. So
Do it. Yeah.
it's absolutely fine. I know loads of people that have done vet nursing later on after doing another previous career. I've got a couple of friends who actually worked in the bank and were lawyers before they were vet nurses, and they have done their qualification and absolutely love it and have gone straight into the new career with lots of energy. So I don't think it's ever too late, is my answer, I think, to that one.
Yeah, and yeah, just to reassure you that, as Jess says, that there are lots of people. I've had ones in the 60s that are on the program, and the dynamics in a group work really well. Quite often we don't have the younger ones. Actually, it's mostly maybe sort of late 20s, 30s, and then, you know, the odd ones at either end as well, but it works really well within the group. So you're never too old.
Exactly. So I hope that answers. There was a couple of questions. I hope that answers it. If there was anything else, just drop us another email or another question. Okay, so I've got a next attendee is asking about Cornwall, and is it possible to find an apprenticeship? They're in their mid-40s and they're looking to retrain. Is it realistic?
Apprenticeship is, as I say, it's a little bit like gold dust, and that's just trying your luck at all the practices, maybe not looking specifically for the veterinary nursing one. As I say, look into, oh, they've got a receptionist opening or a veterinary care assistant or a kennel assistant, because that's your foot in the door. And quite often you prove yourself in those roles quite quickly. You can move into veterinary nursing. There are lots of practices down there. You know, we know that, and you can look that up on the RCVS website. It will tell you where all the practices are. And certainly, you know, we've got students that are on placement there. But the apprenticeship then, yeah, it's just trying your best to find there. So it's not unrealistic. It sometimes is just a little bit down to luck.
Well, thank you. Great answer. I've got another potential student asking, do you ever get notifications that are vacancies? So we do actually. We have an apprenticeship vacancy page on the website under the Study With Us menu, where we have any vacancies that we are working with employers to fill. So they can sign up, and new vacancy alerts on that page as well. So they would be able to see that. So that's great.
Yeah, and you can set up alerts on those as well. So when you go on them, you can register for any ones that newly get put on there, that it will come straight into your emails.
This potential student says, does this mean you don't have to have a placement to apply for the course? As I thought it said you had to have a placement in the first
No,
place.
we find you a placement.
Yeah.
Yeah.
Great. And then Nina, you have a specific question for you. When you were deciding on a career and educational pathway, did you waver a little on vet med versus vet nursing? Might there be some value to doing one before the other, or can you talk a little about the differences?
I think they're very, very different roles. And that's the thing that quite often, I don't mean we don't encourage it, but if someone comes to me at interview saying they want to be a vet and they're doing the veterinary nursing course, I'm like, you do get that they can be worlds apart. There's very different mindset, and there's difference in terms of, I suppose, sometimes responsibilities as well. And you know, the interactions that you're having with clients will be very different. So it's knowing a little bit more about the specifics of the roles. So whilst yes, you know, the vet nurses might be touching, like they can do a little bit of surgery and things like that, you know, they won't be fixing the limb of a broken dog. And you know, when the clients are coming in with the RTA, it mostly is going to be the vet that is seeing them in those situations as well. So there's high pressure in both ends, but they're very different roles, and there's a different mindset and sometimes different personalities that suit each. So personally, I don't even know if I was aware at the time, and that vet nursing, I suppose specifically, was a university pathway. There weren't many courses that were offered where I was doing it up in Scotland. So I think that you need to know which route you want to go to, because if you want to be a vet, like there are different routes to doing it. There's the foundation courses, there's vet sciences, there's introduction courses that probably would be financially better, but also give you a better grounding to do the vet course as opposed to doing the veterinary nursing route.
Perfect, thank you. So then the next question is, can the apprenticeship be with any local veterinary practice? So you need to be with a training practice, and there'll be a list on the RCVS website, but I'll pass to Nina in case there's any other advice that she could give.
Yeah, so with the apprenticeship specifically, then obviously, you know, that's practice that you've found. So they can't do the apprenticeship unless they are a registered training practice. And the same with placements, that we can't send you into a placement that is not registered as a training practice with the RCVS. That's not the case with the veterinary care assistant course. That could be any practice. And yeah, as Jess said, then there's a list on the RCVS website of every registered training practice in the UK.
Brilliant. So I've got a few questions about qualifications for the degree, so I'm just going to put them into the chat if that's okay, just so that everyone's got that there. So for the degree, you need to have a minimum of 5 GCSEs at grade C or above, or 9 to 4 in English, maths, and science, plus 2 other subjects. So you would be expected to hold a minimum of the following as well. So A-level BBC or BBB to include grade C or above in science, preferably biology, because that'd be really good. Or you could do a BTEC level 3 national extended diploma. So distinction, merit, merit, distinction, distinction, merit in a related subject. And or a recognised access to HE diploma, of which all 45 credits must be at merit or higher in a science or health, and other equivalent qualifications, and entry details for mature or international students can be found on our website, but you can book a meeting with us to discuss in more detail, which I would recommend. And we'd also recommend at least 2 weeks work experience in a veterinary practice, because it would give an advantage to your application, and you can see if you like it. You won't know if you like a job until you've actually done it and gone in. When I did my work experience, I knew immediately this is what I wanted to do with my career. I absolutely loved it. I got involved in all areas of practice as much as I was allowed, and I knew that this was my passion and what I wanted to do. So I really recommend doing that. So I'll put that into the chat. So that should hopefully answer. If you don't have GCSEs, we do expect you to have GCSEs, but we do accept it equivalent. But the RCVS does state that you need to have GCSEs. Nina, is there anything you want to add to that one? No.
No, I think that like most of these ones that are personal to like each circumstance definitely is just contact our admissions team and they'll be able to say yay or nay. The chances are if you've got a degree, then there will be equivalencies because if you've got to that level, I would imagine that they would be able to look at that and go, okay, yes, potentially you've covered this, this, and this. It may be that the sciences aren't covered within it, but we can support and look at sort of other ways to cover those.
Brilliant, thank you. This next question, I think you should contact our admissions team. So is someone who is on a spouse visa considered a UK or overseas student? So definitely, I don't think I can answer that at the moment, so I definitely would reach out separately.
Yeah.
And then is having the diploma instead of the degree considered less of a qualification?
Think we answered
Um,
that one.
Yeah, not at all. Whether you've got a degree, whether you're a diploma, you're still a registered vet nurse. You're equally held in the highest esteem by vets in practice. It's great if you do have a degree, and you just means you've done a bit more theory maybe and gone into more depth in areas. But the diploma program, it's going to give you everything that a degree nurse does as well. It's just as just as intense, isn't it, actually, Nina? Like
Yeah,
very,
absolutely.
very knowledge, a lot of knowledge. And both of them, either if you've got a degree or diploma, no vetting or anyone really is going to say to you, why don't you have a degree? Unless, maybe you are going on, you're a registered vet nurse and then you might go and go on and do education, then maybe you'd need a degree. But to do the job, a diploma or a degree would be absolutely fine. And they'd be happy to have either of us, wouldn't they, I guess?
Yep.
So that's really good. So Middlesex website says entry requirements are 128, which is 96 UCAS points. Is that just for clearing? So you'll need to go onto the clearing website for those details, which I would recommend that you do. And we are still open and that you can apply for that one. Please, can you advise how many days a week would be on campus for the BSc Huntingdon course? Is any of the degree learning carried out online?
No, so that's mostly due to student feedback and I suppose just what Middlesex want us to offer as well is that face-to-face provision. So the only times you won't be at campus is obviously when you're off on placement. So it tends to be that your placement is close to home. And with the being on site, it's generally 3 to 4 days a week.
Brilliant. For any queries regarding funding, we would recommend that you reach out to the admissions team to see what you could do. But I wouldn't be able to advise on an individual basis at the moment.
Yeah.
Unless, Nina, there's anything you would like to
No, I'm
add.
just saying specifically with any of the ones there, like looking at that question that's come in, I would say that there, the advanced learner loan is an option, and when you look at the advanced learner loan, there is also the bursary that goes alongside that can support with the likes of childcare and extra things as well. So there might be the option of that being something you can do, and with the non-employed route as well, there's the opportunity for you to have kind of a part-time job at the same time, so you might be able to um, obviously get the loan that you're not going to be paying off until you're well qualified and on a certain salary and be earning money at the same time.
Brilliant. This person has said that they hold a BSc in zoology, but they want to transition into vet nursing. So all of that experience in your zoology BSc will definitely be great
Yep,
for vet nursing.
fine.
So excellent, good. Is the level 2 technical certification enough to apply for the level 3 RVN?
I would imagine so. The level 2 is the equivalent of the GCSE, so it's just whether it covers the maths and English as well as the sciences. But again, our admissions team are able to look at each of those.
And then for the foundation veterinary nursing degree, do you accept a mixture of A-level subjects? And I'm not sure what they mean by that.
Maybe it's like BTEC, I'm assuming, or something like
I
that.
think
But
that
yeah,
must have,
it's just
yeah,
usually it's yeah, basically just the equivalents that you'd need for the grade points. I can't remember if it's 56 UCAS points or something like that. But again, you'd be able to check it on the calculator on the UCAS website.
If anyone needs to leave now, I've just had a message. The email to contact is in the chat already, so you can just see that there and then contact there if you've got any further questions. Um, Kaylee says she's currently studying the VCS course and level 2 maths in preparation for nursing. They're based in Scotland and ideally would prefer to do the shorter diploma course. Would this be the best route? I'm currently employed as a VCA within the practice, so I'd be looking to carry out my training there as well as
Sounds
distance
perfect.
learning.
Yep, sounds like you're all sorted to move straight on to the diploma. Yeah, I can't see any issues with that.
Perfect. And is there a specific day that works better for you to be in college online? Is there a way to work out doing the day that suits you, such as if you started the course in October, but the January day works better? Can you figure out doing that day? So I think they're
So,
asking if they can decide what day they do their
no, so it's just
college.
what day we offer. So if there is a specific day that you're looking for, you'll just have to keep an eye on our website until that day and that intake is running. So it does vary.
Is there a level 3 course funded by the government if you're under 19?
I think that with I mean, it's looking at the ones that we've offered there. It depends on the course that you're looking at. So obviously with the degree, then there's the learner loans that are associated with that, and with the diploma, then it's not funded by the government as such unless it's the apprenticeship. The advanced learner loan is a loan that you would need to pay back.
Yeah, thank you. And then what is the best path for an older person with national curriculum teaching experience who wants to work in support with animal welfare? I think that whichever route you do, it needs to work best for you. So I would research and go and have a look at all the different ways into vet nursing and see which one would work for
Yeah,
you.
or
There
even
is no
veterinary
right
care
answer.
assistant, animal care. There's lots. Look at our website and look at all the stories and the blogs from the various different roles, because it might be that the veterinary nursing works, but it could be that actually you see something on there and that tickles your fancy.
And then the next question is regarding the non-employed diploma. It was touched on with being able to be in full-time work alongside this. What is the study week again? Was it only 1 day a week and then studying can be worked around weekends, evenings? Would that day for the course lesson be set day such as ever
Yeah.
Monday?
So the day that your course runs on will be the same. So again, if it's live online or if it's in centre, it as you say, it's a Monday, that's the day you're coming in. There's 2 days worth of learning to be taken around that. But that's not like where you have to sit there and you've got someone live. It's that you can dip into it. So it could be that you say, oh, actually Saturdays and Sundays I'm going to do it. Or you might find that if you do 3 hours a night over a few nights, that you can do it that way. So there's only one set day that has to be that's the day you have to come into college, which will be Monday, Tuesday, Wednesday, or Friday. And the other days is up to you just to get it done. We find that most students are able to accommodate whether that's a weekday, a weekend, or evenings.
And then how many weeks a year does the degree run? Are there breaks, half terms, and are they in line with school holidays? So we do have holidays over like Christmas and Easter and then the summer, but it does depend when you're
No
doing
half terms.
placements
Yeah.
and which, whether you're doing the foundation, whether you're doing your first year, it does depend. But you're given a timetable and that's all given to you in advance. You're given a timetable for the year, which shows where your holidays are, where your breaks are, and it's not 5 days a week for the degree either. There is some days where you're not at uni and that's your study days, and some students do a part-time job alongside that as well. But it depends what you want to do, I guess.
Yeah.
And then, is there a reduction in vet nurse apprenticeships available nationally? As you mentioned, there are less apprenticeship students on the course.
I would say that actually probably that it is reducing. And we always find this over a period of time is that there are dips. We've just gone through a big peak, I suppose, in them a few years ago. So at the minute, I think that practices aren't taking on as many apprentices. So it is going to be even tighter, I suppose, to do it. But we're finding that, funny enough, at the end of it, they're still wanting the qualified vet nurses. So hence why I suppose the non-employed route is working to help support with that as well, and the degree courses.
Brilliant. And then, we said thank you for the webinar. That's great. Thank you. Thank you so much for coming. What is the main difference in career between level 2 and level 3?
The level 2 is the veterinary care assistant. The level 3 is the veterinary nursing. So the veterinary care assistant isn't a profession as such. The veterinary nursing is. It is again in terms of responsibility. Well, you know this as well, Jess. That there's a lot more responsibility, I think, with the veterinary nursing one. You're supporting with minor surgery. You can help with anaesthesia. And you are interacting a lot more with the client. The veterinary care assistant may take more of a very supportive role. So it might be the cleaning out of the kennels and the cleaning of the wounds, and they might be at the extent of putting on the bandages, but ultimately that's going to be probably under the guidance of the vet nurse. So it is, yeah, it's a role in itself, and it's a very valued one. However, the level of responsibility and I suppose the variety in it may not be as much.
Real. Thank you. And if you do manage to get into a VCA position, how would you progress from that into a vet nursing route?
Yeah, I mean, I suppose you would use that potentially as your qualifications. Hopefully, that you've made a good impression in that practice if you've just been volunteering, and they might be willing to take you on either as a paid role or to take you on as yeah, the voluntary placement one. So, and I think the fact of you doing that and having that experience then puts you at a higher level when you're applying for other jobs as well, because they'll know that you've been in there and you've got a good insight into what's happened.
Brilliant. Thank you. And that is it, I think. We've got a few thank yous in the chat. Well, thank you so much for coming. I'm glad you found it interesting and useful. That's awesome. And I don't think there is, oh no, we've got one more question. I'm unable to find a placement as they're in quite a rural area. I'm concerned if I took the non-employed route, you may not be able to find me a placement within a reasonable distance.
I mean, we've never not been able to find a student a placement. I'll say that. The reasonable distance, then, yes, that what we usually say is that with our placement team, and we're very fortunate that we have a whole team and their whole job, 9 to 5, 5 days a week, is to find all of our students a placement. And what they do is they obviously look at where you want to be based. So look at where you're living, or if you want to go and live with your gran for a year, like look at the postcode for there, and they'll try all the practices and work their way out. We do say that they will work for, well, basically you may have to travel for up to an hour, but we look at whether you have means of public transport, or sometimes it's, if it might be really far stretched, and we look at whether we can support you and you come down here and use our accommodation. I mean, we've never really had to go down that route. I'm thinking offhand now, because the vast majority, well, all of the students so far, we've been able to find a placement that works for them. But if it is a concern and you want that almost not quite guarantee, then our placement team are more than happy to take calls like that. So you could call us up and ask to speak to the placement team, tell them where you live, and they might be able to go, you know what, actually, we've got someone that we've placed year after year in a practice 20 minutes away. So you might find that that settles things a little bit.
Brilliant. And then I think this is the last question, but if there is a few others, we'll stay behind. But last question, can you explain more on how you can top up from vet nursing to becoming a vet? are there gateways degrees to vet medicine and surgery? As you're the vet,
Yeah.
I'll let you answer.
Yeah, and this is why I'm saying it's not the best route, and I'm being very honest about that. Is that again, the students that we have had that have done it, it's given them the entry requirements, and I suppose given them a boost in terms of experience that they've had, but they've still had to start year one of the degree course, and quite often they've had high almost expectations as well, like they've had to get a 2-1 or a first to get in. Um, and yes, like the students have managed and they've got in and they've succeeded that route. But if you know that a vet is what you want to be, it's maybe look at different options, look at those foundation programs, look at the introductory courses. And I think that you'll find that those are probably a better route into it. I think any experience, I'll just answer that before you've asked it, Jessica. So someone has asked there just about voluntary experience at a
Mhm.
wildlife centre. Any hands-on experience with animals or people, to be honest, is valued. Whatever you can get is always going to be of use.
And I think that is it.
Well, thank you
I was
all
just
so
typing an
much.
answer.
Yeah.
Perfect. Thank you ever so much for coming. It's been great.
Thank you, everybody. Bye.